everyone is somebody out there. And if you think nothing more than that everyone is somebody, and if you began to see people that way, like, I know that person belongs to somebody. And what would I do if that was my somebody? Would I want somebody to take care of them? So my name is Shawn Marzen, and I'm the program manager for the Street Medicine Community Outreach. What I pride our team on doing, and our organization as an entity doing, is getting back to seeing humans as humans. You get away from seeing them as patients, or you get away from seeing as a certain population. You get away from treating people as algorithms. For us, when you meet the individual where they're at, whether it's an encampment, a shelter, an overpass, an underpass, a park, and when you meet them there, when you truly meet them there where they're at, you bring all the facets, you bring all your tools. So you provide the medical aid, you provide those continuation services, you provide harm reduction resources, as well as dignity, compassion. Don't think people don't want help just because they're not asking. Sometimes you have to go to find them, to give them help, to be that conduit, to say, I'm here if you need me. And sometimes it's just being there and just sitting and like, tell me your story of how this came to be, and let's work on it from there. I mean, street medicine, it doesn't work without collaborations. You can't just have a single person or a single entity. But at the end of the day, we're all working towards the same end goal. The same end state is to take care of the patient, wherever we find them. Like, find them, do what you can in that moment, try and fulfill the needs that you can. If you can't, who can you get into that enclosed loop that can bring that full circle of care? We have been able to assist people with their not just their basic needs, but we can say, hey, we have helped this patient with their chronic hypertension. But even outside of that, we've been able to see success in patients wanting behavioral health, wanting to get into substance use treatment, and successfully they have. They've gotten to the point where they can do that. We're really getting back to the grassroots of what community health is, and that's being the community. So for us, it's something that's ingrained in Stride, and it's something that the entire organization is passionate about, which helps me out because I'm super passionate about it. So it kind of goes hand in hand. When it comes to street medicine and the future of it, I mean, it's growing by leaps and bounds, and I think it's a job that not everybody wants to, and not everybody can do, because it's meeting people in their most vulnerable space and willing to be vulnerable with them, to not be the healthcare provider, to not be the behavioral provider, to not be this provider or that provider, that title, but to be another person. I'm going to continue to do it as long as I can, and hopefully be that piece that keeps driving organizations to keep doing the things that we're doing.
Nurses are that first layer for students to be able to be in the classroom. If a student's not safe, healthy, fed, clean, ready to learn, they can't be at school. Our nurses have equitable assignments, so they can spend more time in the classrooms with the students, making sure that we're removing those barriers. Hi, I'm Tanya Weaver, and I'm the Director of Health Services for Jeffco Public Schools.
And I'm Lindsay Patton. I'm the Coordinator of Health Services for Jeffco Public Schools.
And I'm Tammy Jeffrey. I'm the Assistant Director of Health Services with Jeffco.
I'm Megan Amio, and I'm a District Nurse with Jeffco Public Schools.
My name is Sarah Sanders, and I'm a registered nurse. I'm a Coordinator of Health Services for Jeffco Schools.
We have a real focus in health services to connect, educate, and empower. I think when we think about the scope of practice for a school nurse, it is a really elevated practice. Working with community partners, really thinking about the whole student, the mental health aspect, the physical aspect, and the emotional aspect.
Integrating public health into schools is so important because as a nurse who has worked in the schools, I have seen just so many things that we've done to help improve the health of students.
We manage chronic conditions, we monitor communicable illnesses, we also implement health education programs, hand hygiene, healthy eating, good sleeping habits, all those things. We really work with our communities and our families trying to promote these healthy habits and prevent illnesses.
I feel like we've had really good collaboration with JCPH. They're definitely instrumental in how we manage a lot of the things in our schools, specifically when it comes to communicable diseases and our response. This has been a really rough year with flu outbreaks, RSV, COVID, norovirus. Having that relationship built with them, that we work so closely with our nurses, really helps us kind of get ahead of the game and help jump onto those outbreaks quickly so that we can start mitigating strategies to help slow the spread of different things around the school.
And we've had some vaccination clinics that we've worked with the public health department in go to certain schools so that the kiddos who are having trouble accessing healthcare can get their immunizations at these locations. And it's been really, really successful.
Our nurses have developed a work group to work with Jefferson County Public Health in increasing our emergency preparedness. Being prepared is so key because we learned so many lessons from COVID. So we're looking at all of those things now and how are we prepared as a school district and as a health services team to provide those supports.
The thing that's the most exciting is that we are creating positive change, not only at the school level, but at the community level. The future of nursing is incredibly promising. I think with a growing awareness of the vital role that nurses play in removing barriers for students so they're ready to sit in the classroom and learn is incredibly exciting.
And I really think that we have the potential to become more embedded with our communities and with our schools, and becoming that person as a resource for families, for students, and then having that teamwork with public health to make sure everybody's happy and healthy.
Empowering youth is at the heart of everything that Jefferson County Communities That Care, or Jeffco CTC, does. The fact that we don't just save a seat at the table for youth, but we really build the table around youth. I'm Sasha Hitchings, I use she, her pronouns, and I'm the Executive Director of Jefferson County Communities That Care. We both listen to and we believe the data and experiences that youth share with us. It's really essential in the work that we do, and it helps us ensure that we're creating a safe space for youth to engage. We also recognize that youth are extremely creative and they are problem solvers, and they care and they want to make change to make our community safer and healthier, and wellness is a core for who they are and what they want. So many different stories that I could share, but one in particular that I think really highlights the work of Jeffco CTC and the value of really having that youth-led advocacy is our Building Allyship and Diversity in Jeffco, or BADGE project. So the BADGE project came about based off of feedback that we've received from youth, particularly youth of color and LGBTQ+ youth, where they shared with us that they couldn't always recognize where there was an adult who was safe, who they could go to if they had an issue or a concern. We know that there are significant health disparities with youth of color and LGBTQ+ youth. We also know that a pretty significant protective factor for all youth is whether or not they have a trustworthy adult they can go to if they have concerns or problems. We put a work group together of various individuals within our coalition to really look at this. And what came of it is the BADGE project. They actually get a badge, I'm wearing one here, so that they can be more visible to youth, so that youth can identify this is an adult who has the tools and resources to potentially be a safe person for me to go to. To date, there are 163 adults within Jefferson County who are currently wearing BADGE project badges, which is just a really, really great success. Jeffco CTC wouldn't exist without our community stakeholders. As a coalition, we recognize the importance of the experience, the voices of everyone within the community. It really does drive our work. And we are really fortunate that we have such a diverse coalition that includes government agencies, nonprofit organizations, community members, and youth within our work. Projects like the BADGE project are currently under attack in this political climate. And so there is a lot of work for us to continue to do, and a lot of need within the community to really support this kind of work. We also believe in collective impact, and we recognize that we are stronger working together. With all of the many, many uncertainties and challenges that we're seeing within the world today, I am constantly impressed at the resilience and the creativity of the youth with whom we work with Jeffco CTC. It is an honor for us to be working with youth, and we are extremely excited to continue to work with youth to identify ways in which we can improve our community.
What we do in this program is community risk reduction. It's public health. And we've had to have a mind shift of, we're not measuring or with a stopwatch, how quickly can we get 20 people to your door to put out a fire. We're thinking about it from a perspective of perhaps managing patients proactively.
My name is Todd Heinel. I am the Division Chief of Emergency Medical Services for West Metro Fire Rescue.
My name is Mike Binney. I'm the EMS captain / program director for our mobile integrated healthcare team.
So my name is Kimmel Brent. I'm an advanced care paramedic here at West Metro.
I'm Aurora Hunt. I'm a family nurse practitioner here at West Metro Fire and Rescue.
The Advanced Resource Medic, the ARM car, is something that's very important to us, and it's a priority to our organization. The team is not just treatment in place, but they are doing a lot of care navigation and education so that people are getting their needs met and not having to rely on 911 as the gateway to their health care.
Through 2 different arms, which are really our focus of the program, first being on-scene treatment, and then the second through our social service navigation.
So we do a variety of interventions. Some are fairly long-term. I was just talking to one of our long-term people today who was formerly unhoused and called EMS 5 times a day. And over the course of the year or so we've been seeing him, we were able to get him into a specialist, got him a med minder and put his meds in it so he can take them regularly. He's not calling 911 all the time.
The fact that we have nurse practitioners and PAs working is a very unique opportunity. So if we can better understand how we can leverage the use of our community paramedics and mid-level providers to work with intentionality in the medical clinical domain, I think that's where our most impactful scale comes from.
The ARM car was able to invest the time to understand, what do you need to prevent these 911 calls? What resources are out there, and how can we best help you?
We've seen a 75 to 80% reduction in reuse of 911 once the team has intervened. So it is making a difference.
It's just made us much more effective to have all these relationships, both formal and informal, to help navigate the system, because the system is complex and messy.
Now, it's not most appropriate to take a patient to the emergency room where costs are high because they're built for traumas. So through now being able to treat on scene in a cost-effective manner, it's more appropriate to keep certain patients at home. And in the past, that wasn't even an option.
We just have this unique opportunity to try new and interesting things and try and help people age in place and help them transition when they need to. It is a gift.
As our program evolves and changes over time, we just have to say, like, our goalpost is not the traditional fire department goalpost. And that's a really neat and interesting opportunity that we have to keep framing our program in a different perspective, internally and externally.
Best job I ever had. So much fun. Thanks for that. Bam!
It's weird when only 2 people do it.